Welcome to the Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. We have a great guest on today, Janine Pratt, General Manager of Wipro Healthcare. Janine, welcome to the program.
Thank you for having me, Tom. It's a pleasure to be here.
Yeah, Wipro is not always the name that comes off the tip of the tongue when you talk about healthcare and innovation, transformation, but you guys are doing a lot of very interesting things. So why don't you tell us a little bit about yourself and your role, and then we'll get into talking about how Wipro is shifting the market.
Sure, absolutely. So I have been in healthcare well over 20 years. I come with a deep domain expertise. I started out at the University of Miami Miller School of Medicine. I cut my teeth in healthcare in the project management, program management role, and really understand healthcare from the inside out, from a people, processes, technology, and what fuels, a healthy health system, so that technology and people and processes can support a cohesive enterprise. My journey spans from academic medicine through to consulting. I was with Beacon Partners for a number of years as a regional vice president, leading their go-to-market and consulting engagements for the Southern U.S., and then spent over 8 years at KPMG as a senior director, both as a relationship director and delivery. So again, my experience really complements working with large, complex health systems that, have a problem to solve, and they don't really always know where to begin and how to put the puzzle together.
Yeah, and there are certainly a number of problems to be solved in healthcare on many different fronts, and not necessarily problems to solve, but new ways of thinking about how to deliver care and what infrastructure is needed in order to support that venture. So tell us a little bit about Wipro Healthcare.
Yeah, absolutely. So Wipro actually has been around for approximately 75 years. A lot of organizations that hear our name may not know that. Wipro has been focused in the IT and consulting space for well over 40 years. We're $11.5 billion strong and about 1.3 billion in revenues in healthcare. So we're doing quite a bit. We serve the provider market as well as the payer market, and we work with some of the biggest logos around, from a commercial and individual plan, Medicare and Medicaid plans, and providers and health tech and med device organizations. So some of the areas that we work with are, front, middle, and back office improvements. And we layer in consulting, AI, and technical expertise to help bring the right solutions to bear. So for example, we have a digital platforms. We have 2 digital platforms. We serve the Medicare population, specifically Medicare Advantage, with enrollment and billing. We actually have 60% of that market that we serve. And we also serve the Affordable Care Act providers, and we're in 20% of that market, and we have a BPaaS solution for that market. So that's just one of the areas focusing on our payers. Then we have digital operations, where we focus on again the solutions that we can bring to bear in front, middle, and back office, starting with patient experience all the way on through the back end, from revenue cycle, billing, claims, ERP. And then digital transformation. Many of our clients are challenged right now with having to take out cost. As you know, Tom, there was the worst year ever in healthcare last year from a financial perspective. There's no more CARE Act payments. And, organizations are hurting. So digitally, they're trying to figure out, how do I do more with less? How do I create a more cost efficient model without compromising care? And how do I enable, digital health, which could also mean digital medicine, telehealth. So we have a variety of partners and solutions around that where we can help to have cost efficiencies and provide a modern workforce for them.
Interesting. So when you talk about a digital platform in Medicare and your infrastructure solutions influencing 60% of the market, tell us a little bit more about what you're doing specifically in Medicare and even in Medicaid for that matter, relative to where Wipro plays.
Sure. So let's make the assumption that you are a payvider, meaning that you're a provider that is now wanting to stand up an employee-sponsored health plan. We can come to you with a solution for enrollment, billing, and BPAS to help host your health plan. So we have that out of the box solution that we can bring to bear. We can white label it, and it is then your solution. And we have the whole life cycle from enrollment to even for sales, right? So let's say you have a sales team that wants to sell your plan and they want to get members. So we have that end-to-end solution from cradle to grave, whereby we can host that platform. Wipro made an acquisition about 6 or 7 years ago with a system that was called HPS for health plan services, and we've incorporated that into part of our core. So we could do it very, very efficiently, and we can help a provider make that leap to payvider and bring that out of the box turnkey solution.
Interesting. And then that parlays, I would think, to some degree with your involvement with the ACAs and controlling 20% of that particular market. Is that a fair statement?
Yeah, no, absolutely. Our payer presence is very, very significant. We work with some of the largest payers in the country, and we work with them in a variety of ways. So, for example, member experience, we are helping to create a member experience that is more valuable, more sticky, and helps the payer be able to deliver quality to that member. So, for example, with the infusion of AI and Gen AI, we are in the process of deploying solutions that help that call center agent make that experience with the member much more personalized and much more valuable. So, for example, let's say we have a member that's calling into a plan to say, I just went to my dentist and I need a root canal. Is a root canal covered? The agent will be able to focus on the conversation with the member, but the Gen AI agent is listening in the background and helping to augment and assist the agent by pulling up like the DNA on the person that's calling. Here's their plan, here's their deductible, here's where they live, here's some dentists they can go to, here's what's in network, here's what's out of network, and the agent is able to give that valuable information to the member. So as opposed to somebody focusing on a computer as they're listening and typing and reading, they're focusing on the member and or the patient and delivering the information, serving that information up in a personalized way and giving them options. And we can even do this with price transparency as well. And then at the end of the call, we're giving them a summary of everything we told them so they have it in writing. So
So,
that's
I mean,
just one example.
yeah, and the fundamentals there is data. You
Correct.
have a very rich accumulation and aggregation and normalizing, I would say, of the data relative to information you have on not only the patient's profile from a health plan perspective, what's their plan say relative to what deductibles are and who's in their network and things of that nature, but also from what the claims flowing through your systems. So Wipro talks a little bit about the Wipro interoperability solution. Is that bringing in the clinical data as well?
Yes.
Okay.
So let me backtrack a moment. We are all about data, right? Wipro does an excellent job from cradle to grave of being able to help a client be able to take their data, synthesize it, go from on-prem to cloud, be able to make that data usable to drive insights. And we have tools to help accelerate this journey that we leverage in healthcare. It's called Cloud Studio. Many of the challenges with cloud is, are you on-prem? Are you off-prem? Are you hybrid? Do I go private cloud? Do I go public cloud? Do I go hybrid cloud? So we have the skill set and the experience and the references to be able to help a client to make that leap. And once the data is in a place that can be, I'm going to use the word harvested because that's what you're doing in a safe way via AI. You have to harvest that data. Once the data is in a space that it can be harvested, that's where the power of AI really, really lies, and the power of any kind of automation.
Yeah. The power of data fundamentally is the strategic differentiation moving forward, in my view. When you
Yeah.
have the CMS making statements that, or establishing or setting goals and objectives that says, I want every provider to be in a value-based care plan by 2030, that suddenly changes the whole ecosystem, and it really changes the way, not so that, yeah, so that statement alone impacts 1.1 million providers in the US. So
Yeah.
now we all have to start thinking differently. It's not just about the hospitals, not just about the payers. I'm thinking, not and it's going to be very tough for the individual provider to adopt these transformations, and I don't even think that that's a Wipro market per se, but there are large independent physician associations that are looking to establish this clinically integrated state. Not only do they currently have it, but they have to enhance it in order to meet this challenge.
Mhm.
ACOs are the same way. Large ACOs are the same way. They have a disparity of doctors across the ecosystem, but they need the aggregation of the data, no matter where you might be and no matter what physician you might have seen, to actually, to your point, whoever that patient engages within that IPA or ACO or health system or payer, they can tell that full story. I used to say that, hey, I'm from New Jersey, right? I go to New York for system. I can go to New York, great healthcare in New York City, right? I got great healthcare in Princeton, in the Princeton area where I'm from, and I can go to Philadelphia, right? 3 states, 3 different health systems. The only one that really knew about me was my payer, right? The three different HIEs, 3 different EHRs, 3 different everything. No one knew about the other except for the claim information that my payer
Mhm.
got.
That's right.
If I submitted the claim versus paying cash. So the point here is that as we move to value, data has to follow you,
Does,
right?
and it does have to follow you, and you have to be able, as whether you're an ACO, you're a large provider network, an IDN, you have to be able to have the ability to take that data and be able to know, when I go into a value-based care model, what is the cost of care? Many organizations do not know what that cost of care is. And again, they have to bring that data together. It's a combination of claims data and clinical data to be able to aggregate that together to know what is the cost of care and what bundles should I go at, should I, play with? What bundles should I say we will do this as a value-based care bundle? Where should I step my toe in the water? And the insights are not readily available.
Yeah, exactly. So where do you see? So Wipro was very much involved on the consultative side, right?
Hmm.
And one of your differentiators is that you don't do just consulting, the strategy side of the equation. You go from strategy to steady state, meaning you've taken your strategy. You've actually eaten your own dog food, if you will, and
Hmm.
implemented it, and then established this steady state. Tell us where you believe via Wipro Healthcare the market is going in context of this move to value?
I think the market is really struggling with how do I create efficiencies in the market as they move to this next evolution. I mean, think about it. The cost of labor has gone sky high. The cost of technical resources has gone sky high. Many of the challenges that we have in COVID or we experienced in COVID have now become part of the core ecosystem. Nurses are striking. They want more money. You can't get blood out of a stone. Reimbursements are shrinking. Value-based care is coming. You still have to take care of a patient, and there's wage inflation. So what we are seeing is an urgent inquiry from the market of where can I create efficiencies. A lot of this is being able to look at infrastructure cost, cloud computing cost, reduce technical debt, and offload some of that risk. Which if you are outsourcing some of your ecosystem, you then take that cybersecurity, and that cybersecurity responsibility now goes to your partner. So the shift is really, how do I migrate some services, some technical debt, and be able to create an innovation fund, so to speak, to be able to reinvest in this organization so that we can, successfully move to value-based care, move to a consumer-based model where these health systems can act more like an Amazon of healthcare because they have the investments to be able to put those digital tools, digital operations in place at the front end to, meet the patient, which is a consumer, where they are.
Yeah, and do you think that the two interesting points? Chen Med, who I've had on the program before, Dr. Chris Chen, would say that 70% of today's health issues are related to behaviors,
Mm-hmm.
right?
Yep.
And so the question is, how do you change the consumer side in order to change behaviors, right?
Yeah.
The flip side of that is that you have 1.1 million doctors out there that are in a fee-for-service model being told to go to value, but there's no unified strategy in order to on how to get there. And and somewhat the point is that sometimes, with all due respect to the provider, when they ask themselves, how do I need to make more money because I have more overhead, right? It costs to the business, and so I have to tread faster. Tread faster meaning I need to see more. I need to see more patients in the same period of time that
Mm-hmm.
I have allocated in the day. Right. That
Mm-hmm.
means each patient gets a little less to the doctor as they go forward. That's not necessarily good healthcare. And then you got other systems like these urgent care centers. I'll call out a bit and say, they're just skimming off the top because it's not a holistic care, and it's not value based. It's opportunity based. Of, hey, I'm just going to go to my corner drugstore and get a quick encounter so I can get my antibiotics and go, right.
Mm-hmm.
So it just doesn't. What are your thoughts on this lack of unity in context of, well, how do I get the value for
Yeah.
those individual providers and a bulk of the overall market, trying to figure that out? It's not, hey, get the value and you got by
Yeah.
2030 to get there, right? It's just, it doesn't work.
So I think that it's a challenge based on the population that is aging, right? I think you have to look at the younger generation as being able and willing to take more ownership of their health care, of their health record, of the Internet of Things, of connected devices, so that they say, "Oh, my blood pressure or my heart rate is low," or the Internet of Things being able to supplement and being open to that ownership of their healthcare. If you look at, an older generation, I don't think generationally you're going to be able to get them to take to take ownership of their healthcare in the same way. For instance, if you look at like a hospital at home or home monitoring, telehealth and home monitoring, they're very, very challenged, and there needs to be support at home in the doctor's office to help them understand that we need to have these monitoring at home, and we need to ensure we keep you healthy and out of the hospital. And how do we do that? And they have to embrace technology. So I think it's a generational question, and it will be a generational movement for those that will want to take ownership, and that older generation that will be more reluctant to embrace technology.
Yeah, I do think that that is a good part of the answer. I think the answer to how do I get the value sits within value. Sits within a fee for service model. And
Mm-hmm.
when I say that, I look, as you know, I'm very much involved through GenieMD with the virtual care model. Personally, I think that is part of the answer. If I'm a provider and I can adopt remote patient monitoring, chronic care management, behavioral health, a number of different virtual programs. I can start to see medication adherence issues. I
Mm-hmm.
can start to see how their programs reduce emergency room visits. I can start to see reduction of hospitalization, all within a fee for service model.
Mm-hmm.
Now I can make the leap because now I have confidence on what I need to do. Now I'm gonna. It's not a blind jump to value. It's an educated jump to value because you have that experience. The only difference now is you're going to be taking on more risk based on what you know your program can do and has done versus how do I get the value, right?
Yep.
So
Data is key. Data
and
is key. So many organizations and healthcare in general has been collecting data for eons, research data, years and years of data. Where is it? It's siloed, it's in different
yeah.
systems and
So that
aggregated.
gets back to the idea of health systems, IPAs, ACOs, payers collaborating. In today's world, if a primary care provider did remote patient monitoring and you had and or chronic care management because the patient had two or more chronic conditions,
Hmm.
I'm the only one that sees the data.
That's it.
Right, the patient's cardiologist doesn't see it. The patient's urologist, no other urologist sees it other than the primary care or whoever got to that patient first. With data being aggregated, and that's what I was liking about what Wipro was doing, is that with data, even across an IPA, a health system, everybody sees the patient record,
Yeah,
right?
we
Independent of
have.
what EHR you have, and then everybody can act on the same set of data. Your thoughts?
Yeah. Yeah, we have tools that allow us to aggregate data from across the ecosystem using SmartFire. So we are actively doing this today. We are taking data from all types of sources, and we're able to aggregate it, get it into a data lake, and drive insights for our clients. Again, we have longevity, across all markets. We bring an outside-in approach to healthcare. I mean, take the lessons of energy, of consumer and retail, of fintech, and we've been able to bring all of those lessons into healthcare to create, economies of scale. We've created tools that allow somebody to, hyperscale to the cloud to get to this point, and not to mention, the AI capabilities and solutions that we've been able to build. I'll give you one quick example. Epic has dipped their toe in the water pretty large with AI, and there is a solution that's being tested in the market for AI assisted coding with a human in the loop. We've actually developed this for the non-Epic environment, where we are able to take the data that's in a medical record as opposed to having a human read everything and come up with it. We have a human in the loop solution that
Mm,
allows a coder to be able to go through volumes of data. It will suggest and support the ICD-10 code, And it also allows, the coder to say this is correct or I need additional support. So you have to have that connectivity. You have to have the insight across the board. And it's something that we do very well by connecting disparate data sources, aggregating the data sources, and putting accelerators and automation in to make the health system have the insights to those data and that data and do your job a little easier.
Yeah, and that's how you alleviate some of the resource crunch, if you will. You're more intelligent on the infrastructure side to help answer questions as opposed to just being a technology cost spend. It
Yeah,
starts to be the technology itself starts to be the ROI
yeah.
to some degree.
Yeah,
And
and from the infrastructure perspective, if a client wants to reduce technical debt and make some changes along the infrastructure of their backbone and potentially look at outsourcing part of that, Wipro has a very, very strong balance sheet. We can look at a business case, and in some cases, if the based on what the construct of the contract looks like, we have the ability to give a cash infusion and write them a check, which is an advance check on their savings, so that they have the ability to use that,
well,
to innovate. Again, we don't do that with every client. It's got to be the construct of the deal. But the point is that we will put fees at risk with our client, and we will make sure we meet those measures, and we put our money where our mouth is, which really
awesome.
no one does in healthcare.
Yeah, that is a very compelling position. Janine Pratt, General Manager of Wipro Healthcare. I truly appreciate you taking the time to join us on the virtual shift. I thank you, and hopefully we'll have you back on the program soon.
Thank you so much for the opportunity, Tom. This has been wonderful.
That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.